Hello Doc, my name is Darshil Shah and in this video provide the instruction about the anatomical surgical hand scrub procedure. So let's start. So this procedure will take 3 to 5 minutes. First check your hands for any cut and inflammation present and you must clean and cut your nails. Before doing this procedure, make sure put your mask on your face and cover your nose and mouth. Also use the surgical cap. So firstly pre-wash your hand with the daily normal hand washing. Scrub doing from the forearm to the 2 inch above your elbow. So this is our normal hand washing. So let's start with the anatomical surgical hand scrub procedure. So firstly wet your hand with the water. Apply the soap to cover the all hand surface. Rub the hand palm to palm. Rotation of the rubbing the left thumb in the right palm and vice versa. Rotation rubbing the backward and forward with the finger of the right hand in the left palm and vice versa. To avoid the contamination, keep the hand above the level of the elbow and away from the scrub and the non-sterile surface. So this is the end of this process. Thank you so much for watching this video. Thank you.
Hello, my name is Dabganero Kumar. Today we are going to see hand washing technique before proceed to any surgical procedure. So let's see. So first wet your hands with water. Apply enough soap to cover entire surface of your hands. Wash thoroughly to remove any gross contamination like bacterial flora. Rinse your both hands with water. Let dry your hands. Start by quickly lathering both of your hands and arms. Scrub arms, keeping hands higher at all time. Wash arms up to 3 inches above the elbow for 1 minute. Scrub between sides of fingers back and front of hands for 2 minutes. Rinse in one direction from fingertips to elbow. Proceed to the OR, holding hands above the elbow. In OR, hands should be dry by using a sterile towel. Thanks for watching.
Hello everyone, this is Ronak Kumar, and for today's video I will be showing you how to properly done the surgical hand scraping. So without any delay, let's start. So before doing this process, so make sure the all material for hand washing and hand scrubbing are prepared, and make sure the no jewelry. If the jewelry, any jewelry, then remove the jewelry.
Stand in front of the sink, turn on water and adjust the flow and make so the procedure of hand washing. First, wet hand with the water. Then secondly, apply enough liquid soap to cover all hand surface. Then rub hand palm to palm and back of finger to position palm with finger interlocks. Then right palm over left dorsum with the interface the finger and vice versa. And then rotation rubbing of left thumb and all fingers, and the same as the other hand and vice versa. And palm to palm with finger interface. Then use foot stick or toothpick in cleaning the fingernails. Make sure to clean each fingernail. Soap toward the forearm and elbow, and properly rub the skin, and then do procedure in other hand and wash the hand properly, hand to the elbow and elbow to hand, and then make sure do not touch anything during this process. And this is the last process of the hand scrubbing. So after hand scrubbing, we proceed to the surgical room. So this is the process to surgical room. Thank you so much.
In the gowning process, with the sterile hands, we have to pick the gown with our left hand and then put our both hands in the gown. Make sure that your hands don't come out the sleeves. And this strap that I picked, it has a kind of cardboard stick to one of its end, which we have to give it to the helper, and he will turn it around your back and hand you over to the another side, and then you have to tie your strap like this. make sure that your hands don't come out of the sleeves. Just check if there is any exposed area. Then make sure that you don't touch the table or anything that are uncontaminated or contaminated. And that's it, you are ready for gloving. Thank you.
My name is Amish Pathan and today I will show you how to wear a surgical gloves. First of all, open the package of the surgical gloves and without touching of the surface area, try to insert your hand directly in the surgical gloves, and remember, don't be scratching the surgical gloves when you are inserting your hand in the surgical gloves. And this is the method for the inserting of the gloves in your hand before the surgery and when you perform any critical surgeries, etc. This is the perfectly way to wear surgical gloves in your hands. Thank you very much.
Hello everyone, myself Jitendra Pal Singh, section 2D. After gowning, we perform gloving. The surgical tech will open and present your gloves, typically starting with the right hand. Place each appropriate hand into the gloves, being carefully to avoid touching anything but the inside of the glove with your exposed hand. Wait until you fully ground and both gloves are before you attempt to adjust your gloves to avoid contamination.
What's up brother, and in this video I'm gonna show the gloves procedure. So take out gloves from its original box and touch only a restricted surface of the gloves corresponding to the wrist at the top edge of the cuff, and don the first gloves and take the second gloves with the bare hand and touch only a restricted surface of gloves corresponding to the wrist, and turn the external surface of the gloves to be donated on the fold fingers of the gloves hand, thus permitting to the gloves the second hand. And once gloved hand should not touch anything else, and that is not defined by the indication and the condition for the gloves use. Thank you.